name is Afonne, but today I'm going to be talking about cognitive behavioral therapies, which is also abbreviated as CBT. Cognitive behavioral therapy is one of those therapies that has been extensively researched for so many years due to the effectiveness of using this therapy to treat so many disorders, more especially mental disorders. Cognitive behavioral therapy has been divided into three types of therapy, which are coping skills therapy, cognitive restructuring, and problem solving. The goal of cognitive behavioral therapy is to help an individual change their pattern of thinking or behavior that may be the cause of their life challenges. It can help an individual to connect with their thought, emotion, and behavior. Cognitive behavioral therapy helps a person to realize their negative thinking in order to see the difficult problem more clearly and able to respond to them in more effective way. For example, a client who is depressed. Some of the clients who are depressed, they feel worthless, they are inadequate to desire anything. They rather stay by themselves because they don't want to associate with others. So cognitive behavioral therapy is usually used to help this individual to develop a treatment plan that can be able to engage them in activity that they can gradually engage them in activity that will help them function better with their illness, and eventually they will develop a sense of belonging and a sense of self-worth to them that will make them to participate more in these activities. And cognitive behavioral therapy can be considered very effective either working alone, like I said before, or combination of other therapies. So, and it's also a kind of therapy that can be used on one-on-one, or it can be used as a group therapy. So it can be effective in both for individual treatment plan or for a group therapy. So, cognitive behavioral therapy has been considered to be effective in treating these disorders, which are depression, post-traumatic stress disorder, anger, childhood somatic disorder, generalized anxiety disorder, panic disorder, obsessive compulsive disorder. Many therapists prefer cognitive behavioral therapy because it is helpful to help their clients to identify and cope with specific challenges they are facing. This therapy also only requires a few sessions when compared to other therapy. So, like other therapies, like the client might be required to come for so many sessions, but with cognitive behavioral therapy, it's concise in a small session, and the client is not required to come all the time for this therapy because it's a short term and it's more effective that way. So that's why I have to add that it's a form of structured. It's like a structured way to help the client target the main issue, and the therapists were able to develop a positive coping skills to help them resolve the issue that they are facing. So, client can also learn about mental health conditions and about different techniques. So, the client can also develop different techniques such as realization, coping skill, stress management, and being assertive. Cognitive behavioral therapy is efficient in treating mental disorders, more especially fear, anxiety, phobia, substance abuse, depression. In some cases, many therapists or many professionals prefer to combine cognitive therapy with medication or any other therapy to get effective results with a particular disorder. So, for example, many therapists might combine cognitive behavioral therapy with antidepressant, for example, for a patient who is depressed. So, that might produce more effective outcome. So, in conclusion, cognitive behavioral therapies has been considered more efficient in treating mental disorders, and even though there are so many studies that have been carried out to show the effectiveness of cognitive therapy, there are still some still some disagreement that most therapy believe that is not efficient for every client. So, but at the most part, cognitive behavioral therapy has been considered to be very effective in treating so many disorders, and there has been an effective outcome in breakthrough, more especially treating patients who are depressed or patients who are dealing with substance abuse. This is where I'm going to end for this. Thank you so much for listening. Bye.